Good afternoon, everybody, and from wherever you are around the world, good morning and good evening. Thank you for joining us on another Nutrition Webinar Sunday. I'm Amy Lietman, President of NTM Info and Research. I'll be your moderator for today's session. Today's topic is nutrition and bone health. We're pleased to welcome back Michelle MacDonald from National Jewish Health. Most of you are familiar with Michelle, and many of you have taken a lot of her guidance to heart with her other webinars, and we're really glad to have her back today. Michelle is a clinical dietitian and certified diabetes educator at National Jewish Health in Denver, Colorado. She provides compassionate, comprehensive nutritional care to adult patients with various chronic conditions, including bronchiectasis, cardiovascular disease, chronic kidney disease, chronic obstructive pulmonary disease, gastrointestinal disease, interstitial lung disease, non-tuberculous mycobacterial disease, obesity and overweight, rheumatoid arthritis, scleroderma, and type 2 diabetes. Michelle works closely with multidisciplinary teams of specialty clinics, counseling both inpatients and outpatients. She's dedicated to helping patients using nutrition as a supportive therapy to manage disease and optimize health. Michelle completed a Bachelor of Science in Human Nutrition at Cornell University, a Master of Science in Food Science and Human Nutrition at Colorado State University, and a dietetic internship at the University of Northern Colorado. Thank you, Michelle, for joining us again today. Today, during the webinar, if you have questions, you can type them into the Q&A box, and we'll go into the queue. At the end of the presentation, I will read the questions out for Michelle to answer. And if there's any additional information that needs to be put into there, we can also type that into the Q&A box for you to see. We'd like to thank INSMED for their support of our activities throughout the year. Without their support and the support of people like you, we cannot continue to bring you this wonderful programming that we have for now the second year in a row. And we're delighted to continue to bring you this online programming. Don't forget to find us on social media. You can find us on Instagram, Facebook, Twitter, and LinkedIn. And you can also find our webinar series on YouTube. We archive all of our past broadcasts. You can also learn more and sign up for the latest news at ntminfo.org. Michelle, thank you so much for coming. We're delighted to have you back. The floor is yours.
Thanks, Amy. It's good to be back. This is a good topic and one that I think is relevant not only to me as I get older, but other women in my life, and certainly the population with NTM, LD, and bronchiectasis, because the population is largely women who are age 50 and older, not exclusively, but so this is a good topic that I think is very pertinent. Okay, let me go ahead and share my screen. And I'll go ahead and start. Okay, here we are. So the topic today is nutrition and bone health. And again, thanks for joining. We're going to start with an overview, and then I'll go on to the top 5 diet recommendations for nutrition and bone health to try and keep it succinct. Otherwise, this topic can overflow quite a bit. But in terms of an overview, whenever I talk to people about their bone health, I like to make sure that people understand that bone is thought of as and known to be a dynamic tissue. So it's constantly remodeling. And what we mean by that is that it is being built up and that it is also being broken down. So it's not a static tissue. It's constantly being added to and removed from. Bone balance in general is stable until menopause for women and until around age 50 for men, so kind of a similar age. And I should actually, just as a side note, make a mention that it's well known that from birth to about age 25 to 30 is when we accrue and develop our peak bone mass. It's between those years. And then in general, we don't accrue or get any stronger after that. So to some degree, we're all well past that age and that opportunity to increase the density of our bones. So now we're just working to protect what we have. We know that 5 to 8 years after menopause, women may lose bone rapidly, so approximately 2 to 3% bone loss per year. And that's triggered by decreased levels of estrogen or an estrogen loss. And then the bone loss will slow to kind of the average yearly loss of 1% of loss of bone per year. For men, after the age of 50, men lose approximately 1% per year for life. So you see that there is this steady decline that's related to aging. I think most of us don't want to get to the point where you pass the threshold that you may have osteoporosis, which is a condition of brittle bones. When you have that condition, you can have a very small incident cause a significant broken bone. So the source for this information is Dr. Bess Dawson-Hughes. Currently, she is the director of the bone metabolism team at the Jean Meyer USDA Human Nutrition Research Center on Aging at Tufts. She's also the former president of the National Osteoporosis Foundation. I tend to follow her because she is at the forefront of research. So what I've told you here, as well as parts of the talk that I've presented, come from her, as well as from other sources that I've used to see if there's consistency between experts, particularly the Harvard School of Public Health. Okay. So to highlight the top 5 diet recommendations for bone health, we are going to focus to some degree on certain micronutrients, but also dietary patterns. So the first one probably is no surprise, but calcium is an integral component of the bone matrix itself. And so in general, the goal is approximately 500 to 1,000 milligrams per day from a variety of sources. And what you should know about this goal that I've put forward is that this is lower than the RDA for women and men. So for women above the age of, I think, 51, the RDA goes to 1,200 milligrams of calcium per day. For men, it goes to 1,200 above the age 70, I believe, or approximately. In any case, when you get above 50 or 70 years old, women and men, then the recommended RDA again goes to 1,200 milligrams per day. I've actually moderated that here based on Dr. Walter Willett's recommendations, who works at the Harvard School of Public Health and is the most internationally cited nutrition scientist in the world. And he's been kind of an icon in nutritional science for many decades. And the reasons for this are probably a little variable and a little bit extensive, but there is concern for getting too much calcium, particularly from supplements. And it seems like we may be able to get by with a little bit less potentially than the USDA. So 1,000 approximates the USDA. If you get a little bit less, and I see that there are other good patterns or features of your diet, I'm generally okay with less, especially if your bone density results show that you have good bone density at your age. So I always try and individualize recommendations, but I'm going to give you this goal with the note that it is a little bit lower than the RDA. So in terms of a variety of sources, most people are very well aware that dairy is high in calcium. I generally recommend 1 to 2 servings of low-fat dairy if you like and tolerate dairy. You don't need to have dairy in your diet to get enough calcium, however. Is my opinion. But if you like dairy, and I generally try and encourage people to eat things like a low-fat Greek yogurt or potentially a low-fat cottage cheese because of the protein sources, because of them being good concentrated sources of protein, then you can include 1 or 2 servings. A serving may be approximately a cup, which can be a lot. So if you're not quite getting a cup per serving, but if you do 2 smaller than average serving sizes of dairy, you'll get somewhere between 1 or 2 servings per day. And in general, you can attribute about 250 milligrams or 300 milligrams of calcium per serving of dairy. You can attribute that to your calcium intake. So you can see how you can get a big chunk that way. But there are other good plant-based sources. And as I will explain later on in the talk, there are actually good reasons to get more plant-based sources of calcium. So we'll look at that, and then maybe I'll say a little bit more about that. But I always recommend people eat a large amount of, if possible, I include greens every day. If you can, get a good quantity of them in and try and do a good variety. So arugula is easy, bok choy is kind of exotic maybe, or at least it is for me, Chinese cabbage, kale, turnip greens, but all greens are going to be a relatively good source of calcium. Green vegetables as well, broccoli rabe or baby broccoli. I actually just had some baby broccoli for lunch, about a cup. And I looked up the vitamin K content. That's coming later. So hold that thought, because I can't remember all the content of all the healthy foods of, their content of vitamins or minerals at the top of my head, but green vegetables are good. Legumes are also good, particularly white beans or soybeans. Nuts are a good source, particularly almonds. Seeds as well, so chia or sesame. I actually make a point of, I really like sesame. I don't digest chia very well. So if I do chia, I'll pick brown chia seeds. I just don't like the taste of them quite as much as some other seeds like flax or hemp. But I like to promote sesame seeds because I guess maybe because I like them so much. They're good toasted. They're good on hummus. They're good on salmon with broccoli and brown rice. They're good on various dishes just to sprinkle on. They could be good on salads as well. Fruits can be a relatively good source of calcium, like figs or oranges. And canned salmon or sardines, because they contain bones. And if you're eating them in a form where the bones are soft, then you're getting calcium from that source. And then I think I mentioned on here, consider a daily calcium supplement, but try and avoid excessive calcium in excess of your needs. But a reasonable, I think, approach would be to take a calcium supplement that's 500 or 600 milligrams per day, once a day with vitamin D, because vitamin D helps you absorb calcium in your gut, which is where you need to absorb it. And then you can, in general, most people are going to be getting 500 or 600 milligrams per day calcium from their diet. So if you're getting that much, which might be low to moderate end, and you're not getting much more for various reasons, then it is completely appropriate to take a calcium supplement, in my opinion, especially if you've demonstrated, especially if you're postmenopausal, especially if you're in an age range, men or women, that might put you at risk for bone loss, above 50, for instance, or status postmenopause. And so where I was going with this is, if you're in the low to mid range of calcium intake in your diet, consider a supplement. But you may only need 500 or 600 milligrams as a supplemental source per day. A lot of people I see, particularly women, postmenopausal, may have a history of osteoporosis or osteopenia, which is bone loss. They're taking 600 milligrams twice a day, or they're taking 1200 milligrams at one time. And I always question whether or not that's excessive. There are potential downsides to excessive. So I would defer to your doctor, particularly if you have a bone condition like osteoporosis, and are wondering about how much you should take. But my general recommendations are here. And I even give out this recommendation for people who have demonstrated some bone loss. And of course, I would anticipate that they would then, if they were to follow this kind of recommendation, if they're worried about not taking enough, then the goal would be to monitor the bone density over time and see if you notice a significant trend one way or another, or maybe stability, which might be good too. Okay, moving on from calcium, vitamin D is an easy number 2 in terms of priority, and this is a micronutrient. As I mentioned, vitamin D it's thought of as a vitamin, but it truly acts in many ways like a hormone, in the sense that it helps direct things in the body. One of the things that it does in our gut as I mentioned before, is that it helps us absorb calcium in our small intestine, and that's the point at which we need to absorb it. So in general, it's good to maintain normal levels of vitamin D. And if you take a calcium supplement, take it with vitamin D. Okay, so I just mentioned this, that I focused on vitamin D helping the digestive system absorb calcium. It also helps the digestive system or the gut absorb phosphorus, which is another key element in our bone matrix. Our bones are essentially a matrix of calcium, phosphorus, as well as other nutrients and proteins, but those are the two key ones. The goal that I usually give people is 600 to 1,000 international units per day. And again, there's going to be some asterisks or special cases here. But in general, for people up to the age of about 70, the RDA is 600 international units per day. If you can get that from your diet, great. And if your vitamin D levels are staying normal at that intake level, great. Above 70, the RDA is 800 international units per day. And those are the general recommendations. Most people I meet and other bodies recommend more, academic bodies or organizations recommend more than that. Harvard, for instance, says in general, most people would benefit from a vitamin D supplement that's 1,000 international units per day, and it's D3, so that's the active form. And I suspect that some of these recommendations may change in the next 5 to 10 years because vitamin D has been such a hot topic for research interest for at least the past decade. And a lot of the big mega vitamin D trials didn't really bear out a lot of fruit, meaning if you're on a huge megadose, it didn't seem to benefit the general population, in a large part because most people started out to be adequate beforehand, before they supplemented. So supplementation as a rule seems to be most beneficial when you start out being low or deficient in something. And in people who have NTM-LD, you could probably argue that you're at risk for having suboptimal intake or being in that category of starting maybe lower than average or lower than desired. So I tend to err on the higher side just as a general recommendation. However, a lot of people are taking more than this. And so I think I would again defer to your doctor, but it may be prudent to take more, especially if you demonstrate insufficient levels. And we think that raising your vitamin D level possibly as high as approximately 50 in terms of your serum levels per day may be beneficial. So this is an area that's, I think, evolving. But again, I tried to give a general goal here, and I do think it is hard to get from food. One of the best sources is fatty fish, like salmon, if you eat fish. So if you're to eat 2 4-ounce servings of fatty fish per week, you're going to get a good dose of vitamin D. You may even be meeting the RDA between 600 to 800 international units per day. But if you don't eat fatty fish, and if you don't, even if you eat foods that are supplemented with vitamin D, like milk, for instance, or dairy products, the supplementation levels in foods like dairy are sufficiently low. I think most of the traditional supplementation, conventional supplementation, is about 100 international units of vitamin D per serving that's found in a fortified food. So it's not clear that it's easy to get in food. We, of course, evolved to get vitamin D from UV exposure to our skin, which will convert a precursor to vitamin D to a form that then gets converted to an active form in the body. Having said that, it's also prudent not to expose yourself to a lot of sunshine to reduce your risk for skin cancer. So in general, I actually think it's a good idea for most people to consider supplementing with vitamin D3 at this time. And a supplement that's 1,000 international units daily is sensible. It may make sense, as I mentioned, for you to take more and monitor your levels. In general, I recommend vitamin D3 in the form of a soft gel. And I usually say to take vitamin D3 with foods that contain fat, because vitamin D3 is a fat soluble vitamin. So in theory, we think it makes sense that if you take vitamin D3, a fat soluble vitamin, with foods that have fat, you're more likely to absorb it at a higher rate. But vitamin D is an interesting topic. And there's a variety of supplements out there. There's even sublingual vitamin D3 or liquid vitamin D3. And I understand that those products actually produce good results as well. So if for some reason you can't take pills or you have difficulty swallowing, there are other options for you. Okay, this one might come as a surprise. And it's partly why I like doing this particular talk or talking on this particular topic. So a low sodium diet may also be beneficial. Even if your BP or blood pressure is normal, sodium may adversely affect your bone. And so what I see a lot actually with older women, or maybe I should say women above the age of 50 or who are postmenopausal, if they have normal blood pressure, they feel like they have they're allowed, they have license to eat as much sodium as they want. They can enjoy as many potato chips or condiments or restaurant takeout foods or just high sodium foods, which are very common in the diet. I think the average American eats approximately 3,500 milligrams of sodium per day. That's on average. A lot of people I see are eating a lot more than that. In any case, so if you're wondering why this, so most people, this is not something, sodium's not something that's on their radar, and they feel like, well, if I have normal blood pressure, then I'm okay. However, we know that dietary sodium is filtered through your kidneys. And when your kidneys excrete the sodium in order to maintain the right balance of sodium and fluid in your blood, calcium is excreted with it. So if you eat a lot of sodium, your kidneys then have to get rid of more than normal. And calcium is excreted at the same time sodium is excreted. So this can put you at risk for potentially losing calcium from your bones. So the goal is, in general, is less than 2,300 milligrams of sodium per day. This is an amount that I took because it's an amount that the Harvard School of Public Health recommends for Americans to eat to essentially reduce their risk of any kind of chronic disease. If you have high blood pressure, or if you're sensitive to sodium, such as if you notice that you retain fluid with it, which I do for sure, then your goal may be less. It may be less than 2,000 milligrams per day, or possibly as low as 1,500 milligrams per day or less, which can be a hard target to achieve. So in general, for anyone who is above the age of 50, regardless of whether or not you have high blood pressure, and honestly, even if you don't seem to be salt sensitive, it still seems to be the case that a low sodium diet is sensible, particularly because it may help you preserve your bone density. So if you can switch to more salt-free seasonings, which are out there in abundance, and use fresh herbs and spices, use lemon juice, lime juice, orange, you can use wine in cooking in order to try and minimize your sodium intake, the better. Okay, moving on to number 4, which is vitamin K. So vitamin K plays a role in the formation and stabilization of bone. And I should note here that a lot of other minerals do as well. I'm just trying to pick out probably what I consider to be the top 5. I do think that you can eat enough vitamin K from your diet. This is where the broccoli came in, because I just ate it and I was thinking, well, how much vitamin K does it have? So my cup of broccoli has, according to the USDA nutrient database, contains about 78 micrograms of vitamin K. My RDA as a woman, I think around the age of 50, is about 90 micrograms per day. So in just 1 cup of broccoli, I'm close to meeting my RDA. So if you can do asparagus, broccoli, Brussels sprouts, dark green lettuce, kale, not sure where this ends, spinach. And then there's caution with anticoagulant or a blood thinner like warfarin. But if you can do green, leafy greens, as well as dark green vegetables, and if you're aiming for, say, 2 to 3 cups of vegetables a day, and if you're trying to keep your weight up, you're doing these probably more cooked or with added oils, like sesame, my toasted sesame oil on things maybe like spinach, or adding olive oil to something, for instance. And vitamin K is also one of the fat soluble vitamins. So it is we think it may be better absorbed if you eat it with foods that have fat. And I was also just reading that it may competitively be absorbed with vitamin D. So if you take supplemental forms, it'd be best not to take them together. But trying to get back on track, vitamin K is important. I do think you can get it by eating 1 or more servings per day of foods rich in vitamin K from your diet. People who are on blood thinners, particularly warfarin is the one that has the interaction with vitamin K rich foods, then you do need to be careful about moderating these, meaning I still tell people it's okay to eat them in small to moderate amounts. We just need you to be consistent every day. So you could still potentially do 2 small servings a day in order to get your the RDA for vitamin K, but not get so much that it's affecting your lab levels related to clotting. Although some people tell me they can't do that. They've tried to be consistent with their vitamin K rich foods, and it causes too much variability. In which case, I would probably just try to do as much as you can without overdoing it, and try to pick some of the foods that are lower in vitamin K, but still meet your RDA. And again, I actually think if, like, for instance, was I going to say green leaf lettuce, or there are some, the dark green leaf lettuce, there are some foods that you can eat, the salad vegetables, that are actually going to give you a low amount of vitamin K, but enough to help you meet your needs through your diet without potentially affecting your clotting labs. What else was I going to say here? A lot of people I see are taking vitamin K supplements, and as far as I'm aware, there's not good evidence that that is actually any more helpful than, say, getting it from food, or and that's partly because people are getting enough in their diet, so supplementing isn't necessarily beneficial. So what's I going to say here? But I see a lot of vitamin K supplements, and I actually think they're probably not needed, or they're redundant potentially with a multivitamin, which might contain, say, 1/4 of the vitamin K you need. I wanted to make a note regarding the supplements here, though, because a lot of people are taking vitamin K in the MK7 form. So I see that just as commonly, and my understanding on MK7 is that it's a form of vitamin K that has a longer half-life than, it's a form of vitamin K2 actually that has a longer half-life than vitamin K1, and therefore it tends to help your blood levels go up and then stay higher. And all I can say there is, assuming you're not on a blood thinner and there's no interaction there, it seems like it may not be necessary, especially if you can get it from food, and especially because it's redundant with a multivitamin. So I don't necessarily recommend supplemental form of vitamin K. Hopefully that's clear. I think I talked a lot on that. Okay, in terms of my last tip, I do caution people about taking too much vitamin A. So preformed vitamin A, such as retinol, is found in some supplements, either multivitamins or other supplemental vitamins and minerals. And we do think that high doses might increase the risk of bone loss as well as fracture. So in general, I tell people to check their supplemental forms for vitamin A, particularly the retinol form, and avoid a dose that is 2,000 international units or greater. We do know that vitamin A in the supplemental form of beta carotene is safe. So what you'll see in a lot of supplements nowadays is they'll say vitamin A in the form of beta carotene, or it will say vitamin A and this percentage of the vitamin A is beta carotene. But I generally try and tell people to use a form of retin A. If you're on a supplement like a multivitamin, find one where you either have retinol that's less than this amount, the 2,000 international units, or in a beta carotene form. Okay, so those are my top 5 tips. There's something else though that I think is important to say, but I'm going to put it under the topic of emerging ideas, in that I would say it's currently under investigation, but in my mind, there's enough basis for it that I live by this, and the topic here is alkaline food, so I'll explain it. And I recommend people do too, in part because it's just the recommendation to choose more alkaline foods is also in line with a healthy diet that's high in vegetables and fruits. So the idea here, the theory is that when we eat certain foods, they're digested, absorbed, and metabolized in the body to contribute to either acids. They contribute either H+, hydrogen ions in the blood, or alternatively, when certain foods are metabolized, they'll contribute to more of an alkaline load in the body. So they might be more potassium containing, for instance. These foods that contribute to the acid load tend to trigger bone breakdown. The reason is when you eat these foods, your body tries to neutralize the acids that have been created through the metabolism, and calcium from your bone is used as a buffer, as a source of alkali in order to neutralize the acid. So you actually see bone breakdown. And I mentioned this before, but very generally, we know that vegetables and fruits tend to promote, after being metabolized, more alkaline substances in the blood. Whereas refined grains, so breakfast cereal, bread, rice, pasta, tortillas, chips, and other snack foods, etc., and also animal proteins are also on this list. But refined grains, additionally animal proteins, legumes, unfortunately, and some other foods are also on the list of foods that create an acid load in the body. I've distilled down the advice to try and pick what I think is most important, which is try and increase your non-starchy vegetables. Starchy vegetables, though, too, are okay. Potatoes, for instance, create more of an alkaline load in this setting here. So I'm smiling on potatoes for this purpose. Most people don't eat enough vegetables, and a lot of people don't eat enough fruit. So my take-home message is really try and shift to eating more of these and start to curb some of the refined grains in your diet that most Americans eat in excess. And I realize not everyone here falls into the category of being most American, but and you also may have competing needs, like you might need to gain weight. But in general, if you can again try and change the proportion of these foods in your diet, then it might help you not increase the amount of bone that you have to break down. In general, I don't tackle cutting back on the animal proteins as much, just because I think there are benefits for the population of NTMLD and other people in general to adequate protein intake. Certainly you can try and switch to more plant-based protein sources. It's good for the environment, might be good for other reasons as well. But I tried to pick the two things that I think might be the most problematic, and also changing them might have the biggest impact. Okay, so that's it. In terms of a brief overview, I hope that was helpful, and I'm happy to take questions. Hopefully I can be helpful.
Okay, thank you. We have a bunch of questions in the queue, so I'll get started. Somebody's saying in a past webinar, this is, this is about another vitamin entirely. In a past webinar, you said to take 250 milligrams of vitamin C, and they can't find that strength. What do you recommend?
That's interesting. It's funny that I'm surprised you can't find it. I guess the first thing I would do is just double check. I feel like Nature Made makes one, but I could be wrong. And then you can always potentially get a vitamin C in pill form and take half, or get a powdered form and just take an appropriate amount. That would be helpful.
Okay. Somebody else is asking, how does one make sure they are absorbing calcium from their diet?
Yeah, so that's an interesting question. Well, first of all, unless you have a malabsorptive condition, like say inflammatory bowel disease, or maybe you've had a surgery of some type, in general, you're going to be absorbing the calcium that you eat in your diet. Now, where this gets interesting is that calcium is found, calcium interacts with other compounds in foods that may decrease its absorption. So like a commonly known component of spinach, for instance, it's oxalate. Oxalate binds calcium, so that is more poorly absorbed. What you should know is that the RDA, which is set at 1200 milligrams, is set knowing that calcium interacts with compounds in foods. So it's set as the amount that you are recommended to eat, taking into account that you're not going to absorb all that, and that there will be variable absorption of the calcium in the foods that you eat. So, so I think your goal practically is still to try and reach that level. And you saw my goal for calcium is a little bit lower than that. Obviously, it depends on your situation, but let's say your goal is based on my recommendation on the high end, 1000 milligrams per day, or the RDA 1200 milligrams per day, then that is your goal for intake. And you don't necessarily need to get caught in the detail or obsess about what percentage of the calcium that you're absorbing. So I think that's what you're getting at. Hopefully I answered the question.
Okay. How does a low carb, high fat diet with intermittent fasting affect a new diagnosis of bronchiectasis in previously healthy people?
Oh gosh, that is off topic. I
Yeah,
appreciate the question.
it is
Yeah, so sorry, maybe repeat the question again, then I'll see.
They're asking about a low carb, high fat diet with intermittent fasting and how it impacts a newly diagnosed patient. If someone was previously healthy. And I don't know if this is so off topic and if it's such a big topic that it would warrant a whole separate.
I know. I'll try and take a stab at it, just because I understand people are like, oh, I get to ask questions. So what immediately comes to mind is that particular style of diet is popular for various reasons. Usually one of the places where it's applicable, and I think reasonable, is if you have blood sugar issues, meaning you have higher blood sugars. Having said that, it can be hard to adapt to that style of eating, especially if you're active, or it can also be hard to find foods to eat and sustain that. So I'm not opposed to you trying that type of diet, as long as you are finding ways to meet your nutrient needs without some of the carbohydrates, and that may include supplementation, as well as long as you're able to maintain your weight and you have good energy, which you possibly could. So I don't necessarily have any opposition to it. I just think you may be at risk for not meeting your nutrient needs or not maintaining healthy weight, and you would just have to make some diet adjustments.
Okay.
Potentially.
All right. Somebody's asking about optimum levels for supplements for bone health. So they're asking about things like vitamin D3 and K2, fish oil, and mushrooms. Which
Yeah,
I'm not
that's
sure what the
interesting.
mushrooms
So
are.
sorry, can you give me the list again?
Sure. It's D3, K2, fish oil, and mushrooms.
So from a bone health perspective, from a bone health, it's hard to know because I don't know what your bone status is necessarily, but I generally recommend 1,000 international units of vitamin D3 daily. And then that could be adjusted upward if you have demonstrated a deficiency or even an insufficiency, particularly if you're starting with low bone density. So that's a general recommendation. I think the question was how much to take. Was that right?
Yeah, what are the optimum levels, I guess?
Oh,
they're asking.
optimum level. Okay,
Yeah.
so maybe that's serum levels. And that's controversial. But based on what I know, so Dr. Beth Dawson-Hughes says that most people only need to be above a serum level of vitamin D3 for bone health. Where I work, we want people above 30, and that seems to be a common clinical standard based on the clinical judgment of the providers with whom you work. For people with NTM-LD or bronchiectasis or any potential, or who might want an immune benefit, some doctors are recommending a serum vitamin D of 50. And I don't know if that's more beneficial or harmful, to be totally honest. But I generally will put myself in the mid-range, meaning 30 or above.
Okay.
Yeah, in terms of K2, I don't have a level in terms of a serum level for that. And I don't necessarily recommend that you supplement other than what you might be taking outside of a multivitamin. I think I addressed that when I talked about K2, but the studies that were done that showed potential benefit used very high doses of vitamin K2. And I don't think they've been conclusive enough for me to recommend a supplement. So I try and get people to get vitamin K1 in their diet and the leafy greens. And then also I think it's reasonable in the setting of NTM-LD and bronchiectasis to take a multivitamin that generally, like Centrum Silver for adults 50 plus, or the generic equivalent of that, has about 25% of your RDA for vitamin K. I think that's enough, in addition to what you also may be getting in your diet. Fish oil, I don't necessarily recommend for bone health. I'm not saying it's not beneficial, but well, sorry, back up. I talked about eating fatty fish for vitamin D intake. So I recommend 2 servings of fatty fish a week, or other seafood. We've talked about other sustainable sources. So I recommend that, but I don't know that you need to supplement outside of that for bone health. And mushrooms, I'm not aware of in terms of supplemental mushrooms having a benefit on bone health. I think mushrooms are good for you. I think they're good plant food that would contribute to alkali to your diet and your body that would be beneficial for bone health. So I would include mushrooms as a way to increase your non-starchy vegetable intake.
Okay. In a somewhat related question, somebody commented if with a supplement of vitamin D3 that's 10,000 units, that equals 250 micrograms. Is that what you recommended? They're asking.
No, that's not what I recommended. That was 10,000 is 10 times what I recommended. So most people don't need 10,000 a day. However, some people who have demonstrated a deficiency or who have true malabsorptive conditions may need that much. It's not common, but I have seen people, I have seen our providers prescribe that at National Jewish. I have also seen people come in with prescriptive forms that are that high, and they're on it daily because they've demonstrated that in order to keep their serum vitamin D above 20 or 30, they need to be on that much. So it's not common, but it can happen.
Okay. Okay. I am a kidney stone. I am a former kidney stone patient, and I was instructed not to take calcium pills by 3 different physicians. What advice can you give this person?
Yeah. So here's what I know about that. So I'm just going to talk a little bit here. Hopefully I won't ramble too much, but in general, I'm trying to remember what we said for calcium supplementation. So the issue is that if you take too much dietary calcium, it can actually promote the formation of calcium stones which makes sense. So in general, you don't want to be on excessive amounts of calcium, and it's easy to be on excessive amounts when you're getting a supplement and getting calcium from your diet. So it is safe to say, as a nephrologist, for instance, to say, don't take dietary calcium. We don't want you getting too much, but it's still okay to aim for your RDA from your diet. So like in someone like you, I might say, okay, let's look at a lower than RDA recommendation for you. You don't have to go too low, but certainly you don't need to be above 1200 milligrams per day. Maybe you could be more in the 750 to 1200 milligram range per day, mostly from your diet. But if you aren't eating dairy foods for some reason, or aren't getting other dairy sources from your foods, it might be worth talking to your providers about taking a supplement in an amount that would not exceed your RDA, but would help you, get up to say 750 or 1000. In general, though, my recommendation is not to take more than the RDA in the form of food and supplements if you have a history of calcium stones. And there's been good research showing that women who have taken calcium for bone health, it increases the risk of kidney stones like 7 years down the road. And what we know about those studies is that those women came in on about 1000 milligrams of calcium per day, and then were given an extra supplemental, an extra calcium supplement of 1000 milligrams. So their total calcium intake in the studies in which supplemental calcium demonstrated increased risk of kidney stones, in those studies, the women were taking over 2000 milligrams of calcium per day. So in my head, and Dr. Bess Dawson-Hughes addresses the kidney stone issue, is not to take more than the RDA, particularly from food or supplements combined.
Okay.
That answers that question.
All right. Does Prempro slow bone loss after menopause?
Ooh, I don't know what that is.
Prempro is, wait, I looked it up. It's a hormone replacement therapy. Prempro was the first estrogen slash progestin combination available for hormone replacement therapy, and is still one of the most common HRTs prescribed by physicians today.
And the question is, does it slow bone loss?
Yes. So I guess, do HRTs do that generally?
So I'm not a doctor, but my understanding is that they do. And the reason they do that is they are mitigating the loss of estrogen, or mitigating the decrease of hormone levels in your body that promote good bone health. So if you're replacing the hormones that you would normally lose, then you are mitigating your risk. So that's my understanding.
Okay.
And just as a personal disclosure, I'm menopausal, postmenopausal, but I went through menopause at age 41 due to surgery, and I've been on hormone replacement therapy since then, very low dose actually, but I have not experienced significant bone loss. So I'm also using my own personal experience as potentially what seems to be true is that the hormones seem to be protective.
So just as an aside, this is actually from something on the NIH website. They note that estrogen and estrogen plus progestin pills add to the body's natural hormones and help slow the breakdown of old bone.
Yeah, so that makes sense. There's a good basis for that. So I think the answer is yes.
Okay. Next question, is broccoli powder acceptable?
Oh, that's interesting. As a calcium source?
I guess that's why they're asking, yeah.
I think so. I would look at I don't know, I have never used broccoli powder, but I would look at the label. Most nutrition facts labels list calcium content, so it would be on there.
Okay. Sesame oil, is that a good substitute for sesame seeds?
No, because it's just the fat. So the fat, as far as I'm aware, the oil is not going to contain calcium. It's going to be the seed source. It's going to be the food, the flesh of the food. It's not the oil that contains the mineral content. Okay.
Don't calcium supplements cause constipation?
They can. So yeah, they can. And I think that's something you have to assess in your own body and based on the dosages that you may take. That's another reason not to take excessive amounts, in my opinion, of supplements as well as potentially food sources.
What about prunes in prevention of osteoporosis? I've heard they're good.
Oh, well, okay. I had not heard that. However, prunes are a fruit, so they would contribute to the alkali derived from your diet. So I don't think they're bad. I don't think most people can tolerate too many prunes though. So I don't know how big of a source they're going to be, or how big of a factor they would be, but I don't think they're bad. I just don't know how much they might promote good bone health.
Okay. Are recommended sodium levels different for people on ketogenic or low carb, high fat diets?
They are. Usually the sodium recommendations are quite a bit higher. So I actually thought about that before the talk. I don't know what the research says about the effects on bone health from those types of diets. To be honest, I don't know. My guess is that the higher sodium requirements would be offset by kind of the changes that happen on those diets. So it wouldn't, it's not the same as someone on a regular, normal, let's say Mediterranean style diet. We would want them to be following lower sodium restrictions. If you're following a diet that may require higher sodium, then I don't know what the recommendations might be in terms of the best sodium intake for the diet as well as to promote bone health. I don't know, but I know that the recommendations are higher, and I presume it would be to some degree okay because your needs are higher.
Mm-hmm. Okay. How much vitamin K should we eat from food? So
for women, I believe, I always get the age 50 or 70, but for people above the age of 50, 55, in general, the RDA for women will be 90 micrograms per day. For men, it's 120 micrograms per day. And as I mentioned in the talk, I think it's easy to hit those targets with diet.
All right. Next one. Even though I have a good diet, exercise, take low dose of estrogen postmenopause, and for the past year have added supplements, 1200/800 calcium and D3, I recently fell from osteopenia into osteoporosis in all bone density test areas. So doctors are strongly encouraging me to start the drug Prolia administered via injection every 6 months. Oral drugs are not a good choice due to GERD. What are your thoughts on this?
Yeah, I think it's completely reasonable to consider some medical management such as Prolia. I don't know that much about the bone drugs, although I understand what you're saying about the oral drugs not being recommended from a GERD perspective, but I can't compare Prolia, or I don't know what reclassed is. There's a group of them, but what I'm hearing you say is that you've tried to be very sensible with your diet and with exercise and with supplements, and you're even on some hormone replacement, and that is not enough. And the way I look at people who develop osteoporosis is that for some reason there's a predisposition there, and your body is preferring to break down bone more so than it is to build it up, despite your best efforts. And I think it's very reasonable and probably recommended that you at least try that route.
Okay. Is powdered collagen helpful?
Oh yeah, collagen is really popular. So collagen is a protein source. It's generally derived from animals. So, to be honest, I don't know. However, if you're using collagen as a protein powder to help you meet your nutrient needs for protein, then in that sense, I would say, yes, it's probably beneficial. Your bones are a protein matrix, protein mineral matrix, and they do need protein. and your needs with NTM-LD or bronchiectasis are higher. Having said that, it is an animal protein, and if you're doing it in excess, then it might work against bone health in terms of it's promoting a more acid environment in your blood that has to be buffered by the calcium in your bones. But my guess is you're using it sensibly, and it may have more benefits than harms.
Okay. Somebody's asking, I love brown rice. Is this considered a refined food?
No, it's considered a whole grain rice.
Okay. What is the best type of yogurt?
One that's unsweetened, number one. I would argue, well, yeah, so unsweetened, although again, if you're trying to gain weight, I'm going to be a lot more lenient in terms of the fat content and the sugar content. But so this is also an I don't know, but in general, I like unsweetened or very lightly sweetened. It's nice if there's a decent amount of probiotics in there, drinkable yogurts. I know that's probably not what you were thinking, but kefir is a very good concentrated source of probiotics. And then yogurt can also be a really good source of protein, and the Greek yogurts tend to be higher than the regular sources. So depending on what you're going for, in general, I like the lightly sweetened or unsweetened. I like the lower fat in general, unless you're trying to gain weight. And then I also like the probiotic forms included, or just part of the yogurt, as well as the protein content. So Greek is generally where I go with this, but it's not always the best. Not everyone likes Greek.
Okay. Thank you. Okay. So does protein breaking down to amino acids increase the buffering and therefore deplete bone density? And then do you think Americans eat too much protein? What is the recommended daily average of protein? And do you agree with that?
Can you break that down again?
Sure. I'll start with part one. Does protein breaking down to amino acids increase the buffering and therefore deplete bone density?
What we know is that protein foods, particularly animal protein foods, seem to create a high acid load in the body. It's not necessarily that they break down to amino acids. All proteins break down to amino acids in our digestive system, but the proteins that make up animal proteins in particular create more acids or protons, H+, in our blood. And that is what can then require the buffering from calcium in our bones. So I try and get people to kind of eat a balance. If they like animal protein, I try and get them to eat a balance of protein and plant and animal sources to try and mitigate that.
Okay. Do you think Americans eat too much protein? Is the next question.
I think it is very easy to meet your RDA of protein, actually, because, well, if I'm speaking generally, most Americans are eating too much. They are eating a lot of high protein foods. So the answer would be yes. And what's interesting is that, the rates of bone fractures in the US are quite high, despite a lot of people supplementing. And I think one of the potential contributing factors is that our diet's really high in animal protein. Having said that, people with NTM-LD or bronchiectasis, you do have increased needs for protein. So a lot of people I see in clinic don't seem to include protein at each of their meals. And I think they would benefit from doing that. So it is hard. You're always trying to determine what's most important in your health. But in general, I do try and get people to aim for about 20 to 30 grams of protein at each of their meals a day. And that is more than the general RDA, but I think it's appropriate in older populations. I think it's appropriate for people who are trying to improve their bone health, as long as they get a good balance. And I certainly think it's appropriate for NTM-LD and bronchiectasis into people with those conditions.
Okay. So you mentioned the RDA. So your recommendation is higher than the RDA.
It is a little higher than the RDA, yeah.
Okay, what is the RDA?
The
Generally?
RDA it's 0.8 grams of protein per kilogram body weight. So I know that probably doesn't make sense, but if you take a woman who's 120 pounds, on average, she's 55 kilograms. So her RDA for protein is going to be 80% of that, which is 44 grams per day.
Mm.
Mhm.
Okay.
Mhm.
If you have low blood pressure, how does that affect your sodium intake?
Oh, that's a good question. That's a good question. I don't know the answer. However, the thing that pops into my mind, which is probably popping into your mind, is maybe I should eat more sodium to help raise my blood pressure. And certainly there are conditions where people have unusually low blood pressures, and the recommendation is to eat quite a bit of more sodium in order to increase the pressure in your vasculature system. So I would probably defer to your doctor on this, but I do think it may be more appropriate for you to have a higher intake of sodium, and you may need to weigh that against what it could potentially be doing to your bones. And it's always, not everyone can monitor everything all the time, but certainly what you try and do is look at what the issue is, try and resolve any conflicts in recommendations, but do the best you can do and try and prioritize, say, the issue that might be most important, and then monitor and see if you're going to do higher sodium because it helps with your low blood pressure, then monitor your bone health over time and try and be sensible, with the other bone health recommendations, diet and lifestyle, to do the best you can do.
Okay. If you take hydrochlorothiazide to help with blood pressure, does that contribute to bone loss? This is from a patient who has osteopenia.
Oh gosh, I don't know. There may very well be an issue there. I don't know the details. So I'm sorry, I don't know.
Okay. Are teas beneficial to bone health? And also, what beverages should you limit or avoid?
You know what I'm going to do? I'm going to stop sharing my presentation, and I might pop over to the internet because I was just looking at this. Let's see. So the question is about what beverages might be helpful, and let's see if I can find. Okay, so in terms of beverages, okay, here we go. So there is actually data showing what the acid load is, what acid load occurs at the kidney when you eat or drink certain foods. And it's hard to interpret all of this, but I'm going to make my best guess. But in general, I'm looking at this list, and let's see. Okay, so green tea is on this particular list. That's the only tea that's listed. So that is a caffeinated tea. Might not be recommended in large amounts with reflux, but it is negative, which means it's more alkali, which means it's better. And cocoa with milk was also good. Same with coffee. Same with green tea, mineral water. These are all on the good list. Orange juice, believe it or not, was on the good list. Red wine, white wine, those are reflux triggers. Those were on the good list. Foods that were on the too acidic list was Coca-Cola, so soda, I presume. Beer was neutral. And then in terms of dairy, milk was slightly acidic. I think of milk because while milk might promote a little bit of an acid load, it does contain calcium. So it's offsetting the higher amount that you might excrete with it or buffer. So what I'm saying is, if dairy tends to cause more loss, but it's also a source of calcium. So it kind of takes care of the increased losses that you might get with it. So I think of it maybe a little bit more neutral. I hope that answers the question. I tried to give you what I can see.
Yeah, that's, okay, yeah, no, but I mean, I think it's hard to know exactly which teas would be.
Mhm.
So our legumes such as soybeans, kidney beans, etc., are they acid producing?
I know, I was worried we were going to get into the weeds in this, but it is interesting to think about. So legumes. So it may depend on the kind of legume. Lentils are acid producing, chickpeas acid producing, soy alkali producing. So I don't know for every specific legume, but soy certainly seems to be one of the better sources.
Okay. If we eat whole wheat bread, couscous, and brown rice, is this better, or do they still qualify as refined grains?
So brown rice, let me look, let me see if there's brown rice on here. Brown rice is a whole grain rice. So that is not a refined grain. And then couscous in general is like a pasta. You can get whole grain couscous, although I find it I'm having a hard time finding that. I usually can't find it. So couscous is like a pasta, which means it's a refined flour or refined white flour product. And what was the third product?
Whole wheat bread.
Whole wheat bread. So, and let me think about where I was. Yeah, let me see if bread's on here. Whole wheat bread is a processed product, but they've added back some of the fiber. So it's kind of in the middle. And unfortunately, my list does not contain anything about brown rice. But I think that's a whole grain, so I'm thumbs up on it. There is interestingly, there's spaghetti on here, which is pasta. Let's see. And for whatever reason, this is coming out as it tends to be alkaline. So maybe couscous isn't so bad after all. It's hard to generalize. It's also hard to make sense of all this, and keep in mind this is really an emerging theory. And so I'm speaking in generalizations when I say try and eat more vegetables or fruits and cut back on some of the refined grains. Not everything's going to fit perfectly into those categories, but as a general rule, if you can try and aim for that, then I think you're doing as good as you can.
Okay. Do spicy foods act the same as the refined grains in increasing acidity and therefore calcium loss?
Spicy food. It's interesting. And so what I am hearing, what I would interpret that as is if you have a hot spice that you've added to a food, or like a hot pepper that might add heat. I don't think the spice is, as far as I'm aware, spice is not a contributing factor to alkali or to whether or not foods are metabolized.
It may contribute to GERD, but that's a different kind of acidity.
Yes.
Okay.
Exactly. Mm-hmm.
All right. What is better, calcium carbonate or calcium citrate? And what about magnesium?
I know, I was wondering if someone's going to ask about magnesium. So both calcium citrate and calcium carbonate, as far as I'm aware, are good sources. However, calcium carbonate requires acid to be digested and broken down so the calcium can be absorbed. So if you're on an acid reducer, like a proton pump inhibitor or any other medication that's going to reduce the acid in your stomach, calcium citrate may be a better form for you because it does not require the higher levels of acidity that calcium carbonate does for being broken down and then digested. What's I going to say? So yeah, so that's one of the factors. Calcium carbonate also, in general, you want to take that when you eat food because then you're going to get acid secretion in the stomach and it will be better absorbed. Calcium citrate you don't necessarily need to take with food because you don't necessarily need that high acid. So it kind of depends on how you want to take it. I actually take a slow release Citracal for my calcium. And it's a combination of some carbonate and some citrate. And I think that contribute to the release of it, but that's what I do. I'm not on an acid reducer, and I generally take that I take that right before breakfast. So without food, but then I eat soon after.
Okay.
I hope that helps.
Yes. If your gallbladder has been removed, do you need to take a digestive enzyme to help absorb calcium?
As far as I'm aware, the answer is no. So your pancreas, not your gallbladder, is generally what's going to help with digestive enzymes to help you break down the nutrients in your food so that they can then be digested in your gut. Your gallbladder does help with bile production. Your gallbladder basically holds the bile that is produced elsewhere. So sorry, it's not producing, it's holding it. So if you've had your gallbladder removed, you still have the bile coming into your system. It's just coming kind of at a slow trickle. You don't necessarily have like a reserve of it that can be released in large amounts or small amounts based on what your body needs at the time. So I don't think that's going to affect your calcium absorption significantly because you're still getting the bile. It's coming in at a more slow, gradual rate. And you're getting your enzymes from your pancreas too. And you're getting the acidity in the stomach for digestion.
Okay. Do you recommend Fosamax or something of that kind for osteopenia?
I cannot answer that. I don't know enough about it, and I'm not. Yeah, I don't know. I mean, I know it's medical management for bone loss, so it certainly seems like it might be helpful if you haven't been able to curb bone loss otherwise. But I don't know enough about that particular medication.
Okay. If we are bone building up until the age of 25 to 30, and thereafter the goal is to protect what we have, is it impossible to build bone or add to what we have in the 5th, 6th, or 7th decades?
That's a good question. I don't know the answer to that. I mean, I want to say yes, but part of me also knows that, well, no, I don't know. However, if there is, I'm optimistic. And if there's your bone is continually remodeling. So, and medications may be able to override some of our body's natural tendency to break down. But if you're able to accrue any amount, so I think it might be possible based on medication and or potentially diet and lifestyle. But I don't know that it's going to be a very large effect. I think if anything, if you're able to accrue anything, it will be a potentially small effect. You know, I've seen people who have said, oh, well, my bone, all my measures of bone health went up. And I wonder if that was potentially medication effect, as well as potentially an instrument within the margin of error of the instrument that measured it. So I'm not sure. Those are some of my thoughts.
Okay. A patient is asking, she says it's very difficult to eat 1,000 milligrams per day of calcium. She can't take calcium supplements. She tried, there was a big increase in her GERD symptoms. She has osteoporosis, takes Prolia shots every 6 months. She's trying to increase the calcium, but it's not easy. She has NTM and bronchiectasis as well. Do you have any suggestions?
And she said she couldn't take calcium supplements because of the GERD.
Yeah, increased her GERD symptoms.
What about a chewable form or potentially a liquid form?
That's a good question. Yeah.
Yeah, those
I don't know if they've tried them, but
that would be what I might try next or consider next or speak with your provider about. I'm also wondering what your provider recommended. Certainly and then I would also be looking at ways to try and get more calcium into your diet and help you follow some of the other diet and lifestyle recommendations that also might be helpful. Sometimes it is hard to do everything the way it's recommended to do it, but
sometimes you do the best you can.
Mm-hmm.
Okay. Do you recommend progesterone cream to help in bone growth or maintaining bone and preventing bone loss, at least after menopause?
I don't know. I don't know that much about progesterone, particularly if you're taking it only and not with estrogen as well. So I
And
don't
they're
know.
asking about progesterone cream specifically.
Yeah. So you would absorb some of it topically is what I'm
Yeah.
understanding. And I don't know. Hormones are, well, you want to be careful with what you're taking and in what context you're taking them. So I don't feel like I know enough about it or know the situation enough to make a good recommendation there.
Okay, we have a patient asking again, a patient with low bone density, bronchiectasis alpha 1, and they need to gain weight. Assuming they do a decent job addressing their bones, what additional foods should they eat to gain some weight and help their bone? And then she says, can I have ice cream every night? Admittedly, I'm eating a bit of that each night now, or are there any other specific snacks you'd recommend?
Oh, that's interesting. Well, certainly I am okay with more dairy if that's an easy way for you to gain weight. And, you know, most people, well, if you like ice cream, you like dairy, you can tolerate it. That's an easy way to get more in. So I am okay with that in this particular instance. I certainly also think of nuts and sesame seeds as very dense forms of calories, protein, and potentially calcium too. So I'd look at that. And then, you know, you could also look at it potentially as supplement, but certainly, I don't know, you can do more dairy than what I've recommended. Meaning you could do ice cream, you could potentially do a whole fat yogurt, you could potentially do cheese. And then you could also add some of the nuts. You could add potentially some of the sesame. There's tahini, which I really like, sesame butter. You could potentially do some fish with the bones. I don't know if you like that, but that also would be a potentially good source that's high calorie, high protein. And I think you may not be able to hit every category of what to do right between sodium and the acid load and the calcium intake. And sometimes you do just have to prioritize the main ones. Make sure your vitamin D is good. Make sure you're getting the high calorie, high sources of foods that also are high in calcium.
Okay. Somebody's asking about a capsule that they take. It's vitamin 3, 1,000, I guess 1,000 units of vitamin D3 and 45 micrograms of K2 in one capsule. Is that good for bone health?
It's 40, how many? What's the microgram?
45 micrograms of K2 and 1,000 units of D3.
Yeah, so I certainly the vitamin D is going to be helpful. Whether or not the K is beneficial, we don't know, but that amount's probably not going to hurt you. So I would say that that's probably good. Yeah.
Okay. Does apple cider vinegar affect bone loss?
Oh, that's interesting. So we've got a vinegar food. Let's see if I have any information on how vinegar affects. So acidic foods aren't necessarily metabolized to acids in your body. So I wouldn't necessarily make the assumption that just because it's an acid, it's bad. However, I don't have any information about how vinegar is metabolized in the body. So my guess is in the amounts that you're taking vinegar, the effect is going to be somewhat small compared to the other things we've talked about.
Okay. As a person with bronchiectasis and on osteoporosis and on medication, would you have any additional nutritional recommendations?
Someone with bronchiectasis and
osteoporosis and they're on medication, I would assume for the osteoporosis, would you have any additional nutritional recommendations?
Then the ones I've already given, no, I don't think so. But I'll clarify. I do think it's important to meet your protein needs as you get older and if you have a chronic recurrent infections. So without pushing the animal protein too much from a bone health perspective, I would look at making, maybe encourage you to look at some other plant-based sources. And I'm making assumptions here, but, maybe add more tofu to your diet, or try it, experiment with it if you haven't ever tried it, or use a protein powder that's plant-based. Maybe look at the balance of the types of proteins that you're eating, just as a little bit of a clarifying point.
Okay. What is your opinion about vegetable and fruit supplements like Nature's Balance, which are widely publicized?
Ooh, I haven't looked at Nature's Balance. Unfortunately, I am a little bit of a skeptic when it comes to those things. For instance, supplement manufacturers that basically say, get all your vegetables and fruits in this number of pills a day. From what I can tell, most of those things cost a great deal more than is their inherent intrinsic value. And so that is that triggers like a red flag in my head to say, I think someone's taking advantage of this situation, and the benefits may not be commensurate with the costs, including the financial cost. And I think there are benefits from eating the real foods fresh, where you're getting a lot of the minerals and vitamins in a more accessible to your body form. And then you're also getting the fiber, which is a phytonutrient, which is good, et cetera, et cetera. So I'm not a huge fan of those. Having said that, I don't know that they're going to hurt you, other than that they might be expensive and you might be taking a lot of pills. I've seen some of them where you take like two or three times a day. And that's a lot of pills. So from a reflux perspective or just a pill burden perspective, that might be an issue. So I'm not necessarily big on the benefits there. But I think the harms might be minimal too. So maybe they're helping, and maybe you don't mind putting forward the cost there. And honestly, I have had a few people anecdotally tell me they think it really helps them not get cold or not get a cold, for instance. But you never know what kind of diet, where someone's starting with, and then when they add something like that, what the effect might be. So for instance, if someone's not eating any fruits and vegetables and then take something like that, they might see a benefit because they were so low to begin with.
Okay. Next question, especially with osteoporosis, do PPIs, statins, and or daily aspirin impact bones? And if so, are there supplements one should be taking while you're on them?
I don't know about statins. And what was the last one?
PPIs, statins, and or daily aspirin.
Yeah, I'm not familiar with data on the statins and the aspirin when it comes to bone health. PPIs, I think there is so I've looked at this with our GI doctors at National Jewish, and I think there is some concern that if you do take a PPI that is acid reducing, it may prevent you from absorbing some vitamins and minerals that may be key for bone health, including calcium. So it is prudent to make sure you're getting at least the RDA, and then you're monitoring your bone density. And you could do that in conjunction with your provider. And then you could do what you can to make sure your diet and your supplements can meet the RDA or the recommended targets for intake.
Okay. Let's see. Most of us boil all of our water for consumption. Should we be concerned about the minerals that get concentrated as a chalky substance in the bottom of our pots? Should we consume it or filter it out before drinking the water?
That's interesting because there are calcium deposits. I believe so. Well, okay, I grew up in Pennsylvania where there was limestone geology. So I think part of what made the water hard was the calcium content. But in general, I don't count the minerals that you might be getting in your water as what we're counting towards your intake. I'm looking at food. And I think that's because I don't know depending on where you are in the country, and again, what the geology is of your region, I don't know the mineral content of your water, and I don't count it as a significant source, in part because I don't know that it is a significant source, and in part because I don't know what the amount is. So I would not add it back to your diet. I would just try and get the calcium from food.
Okay. I make homemade kefir for the calcium for bone health, and because it has more probiotics than store-bought or yogurt. Are there any drawbacks to homemade kefir for MAC or bronchiectasis?
Well, it is a liquid. It's a drinkable form, so we would probably want you to be on the safe side. Drink it with food that will absorb the fluid, so you're less likely to reflux it. But the question is, are there any other drawbacks? Yeah, no, I don't think so. I don't think so, because they are, and I say kefir, I don't know actually how to pronounce it, but it's very high in probiotics. So it is a very healthful food.
Okay. Is fish protein as bad as red meat protein?
From an animal, right? I know. Here we are back on the details here on this. Let's see. See what I have on fish. The answer is yes. They're both they produce quite a bit of fish as a product of animal origin is just as, I don't want to say bad, but it produces as much acid or more as red meats like beef and pork. It's actually, looks like it's, and even chicken. It's on the high end.
Okay.
Yeah, but I would still say I want fish in your diet. We just don't need to be too crazy with the portion size, and we will need to counterbalance it with a good amount of vegetables and try and do all that and maintain a healthy weight.
Okay. How much calcium do you absorb from Tums Extra Strength for GERD?
Oh, Consumer Lab did talk about Tums. I mean, I think you absorb, I think you're gonna, well, okay. So if you're putting Tums in there, you're reducing some of the acid, but Tums is basically a calcium supplement. So I don't know what percentage of a Tums you're going to absorb, but I'm gonna presume it's 75%, meaning the majority of it.
Yeah,
that's my guess.
All right. Does tahini have the same benefits as sesame seeds?
Yes, as far as I'm aware, it's concentrated. It's even more concentrated.
Okay. What is your opinion of the Kirkland gummy 500 milligrams of calcium, where 2 gummies equals 500 milligrams and 3 grams of sugar? They're asking because these gummies are apparently easy to eat.
Yeah, I mean, they're low in sugar. I wouldn't be too worried about that 3 grams. And Kirkland in general, I don't know about that particular supplement, but Kirkland does generally come out well in Consumer Lab reviews of their supplements. So I think if it's easier to take in the chewable form and it's low sugar, that I like it.
Okay. You recommend nuts, especially almonds. I've been avoiding nuts due to concerns about diverticulitis. Should I start eating nuts again?
Maybe do nut butters. Especially if you're concerned about it. And especially if you have a flare and are trying to avoid any like hard to digest foods. But nut butters certainly would be relatively safe because they're smooth. So that would be my recommendation.
Okay. What is a good calcium supplement if you have GERD and are on Nexium? You said that calcium citrate is better. Can you name 1 or 2 that contain that form of calcium? Yeah,
well, so calcium citrate is very prevalent. You'll find it you'll find it everywhere. So I do like the Citracal supplements, partly because I like the slow release, and it's both, but they also I believe they make a pure petite, let me see if I can find this, calcium citrate, pure calcium citrate in their petites, and that's been well reviewed. Let me see if I have this up actually, because I was just looking at this beforehand. Here we go. Let's see if I can find this here. This is osteoporosis. Let's see. I actually don't have the right link Let's see if this is it. Okay, give me a minute. I think I found the right page. So let me just scroll down. Okay, so I think it was. There we go. So maybe I'll just read out the ones that I can see. That I can see are calcium citrate only, and this is per Consumer Lab. So calcium only supplements, calcium citrate only there's a brand called Pure Encapsulations. Not familiar with it, but it was proved as a good form of calcium citrate.
I actually take that brand for some of my supplements.
Oh, yay.
Yeah.
Okay. Then another one that's calcium citrate is Solar Ray brand. That's actually a combination of calcium citrate and calcium carbonate. Let me go down. Okay, then there is, yeah, I was recalling this correctly. Citracal makes a Petites. It's calcium and D. It's 400 milligrams of calcium citrate in 2 coated tablets, and then some D with that. But that one, that one was a top pick because it contained the amount of calcium and D that it said it contained, had no heavy metals, and it disintegrated appropriately in as it should for absorption. Let me see what else I can find here. That's calcium citrate. Weber Naturals calcium citrate is an approved brand. Oh, right. And there was a magnesium question too. Metabolic Maintenance is a brand that has a calcium magnesium powder. And so my feeling on magnesium is that yes, it is an important mineral or element for bone health. I didn't put it in my top 5 because I really did think that the other ones were more important. I think if I recall correctly, the issue with magnesium is that magnesium seemed to help in people who had, with bone health, and people who had lower levels of potentially calcium. I think it was calcium to begin with. So I don't know that it's necessary to have it with a calcium supplement. I certainly don't think it is, but I don't think it will hurt as long as you're not taking an excessive amount and having like problems with diarrhea, because magnesium can have a laxative effect. So I don't think it would hurt, but I don't think it's necessary.
Okay. Somebody's asking again, we had talked about this briefly before, but they were asking about collagen supplements as for, I guess, for bone health.
Mm-hmm.
Can you just review briefly what your thoughts were on that?
So collagen is a protein supplement. So, and protein is important for bone. It is an animal source. So I think what I said was try not to use it excessively, but I think what I mean by that is like 4 or 6 scoops a day. I think what I'm talking about is most people are using like 1 or 2 scoops in a protein shake or something like that. That certainly seems like a reasonable way to get some extra protein. I'm just trying to issue a caution of maybe not using it exclusively and excessively as the protein source.
Okay. And last question, are green peas good for anything?
Of course they are. They're green.
They're delicious.
Yeah, they are. So they're a starchy vegetable, I think, right? The English, like the starchy pea. Is that what we're talking about? We are talking about that, right?
I think so, yeah.
Okay, yeah. So I'm sure, yeah. So I would say yes, they're considered a good vegetable, even though they may be a little bit starchy. But I can't, off the top of my head, I don't know what they're high in, but I would say they're a good food because they're a type of vegetable.
Somebody's noting that they're a good fiber source. There you go.
Good. Yeah,
good for
okay.
fiber.
I should have come up with that. Yeah, they're a good fiber source as a vegetable.
So they are good for something. So
yeah. And my guess is they are green. I would wonder what their calcium content would be. There might be some there.
Yeah, those poor maligned peas, are they good for anything? Of course they are. They're delicious. Enjoy them. Somebody's noting caution with Tums. Somebody said they got kidney stones from Tums. I think probably if you are prone to kidney stones, you have to probably watch your calcium supplement intake in general.
Yeah.
But thank you for the caution. Well, we are done with the Q&A.
Okay.
Thank you very much, everybody. Thank you for attending. Michelle, thank you for another wonderful webinar. We really appreciate it.
You're welcome.
Everybody have a wonderful week. We will see you next month at our next mental wellness webinar. Everybody have a wonderful week and a great month. Thank you.
Thanks, Amy.
Bye-bye.
Bye-bye.